Today is National Speech Language Hearing Month, and joining me with more on the month is Ashley Price. So tell us a little bit what Better Speech and Hearing Month is.
So really it's just to bring awareness to different hearing losses and communication disorders, and really the roles that audiologists and speech pathologists play in those devices.
Yeah, what are some things people should keep in mind when it pertains to the month then?
Really is just kind of awareness. We talk a lot in audiology is hearing, and checking your hearing really relates to overall health and aging healthily, and also brain health, because we hear with our ears but we listen with our brain. So it's good to just kind of keep in mind our ears when we're talking about improving our health.
And how can you protect your hearing?
Really, it's just kind of keeping in mind our noise around us. There's a lot of things and factors at play that we have no control over, but limiting our noise and kind of protecting our ears when we're around loud, noisy environments, that's when it's going to be your prevention.
Yeah, and tell us, I guess, some other things people can look out for, or maybe signs if they maybe feel like they're struggling a little bit.
I always talk with my patients that the best time to do something is when you're ready, and what I find is that patients are ready when it's affecting their quality of life. So things with hearing loss, people start to self-isolate because they don't want to seem like that they're going to miss out on conversations. They're embarrassed by a lot of that. But that quality of life, self-isolation, not being able to participate in communication and social events and things like that, it really does play a toll on our mental health. So making sure that if we are starting to see those things, or you're starting to see those things with your family members, to start bringing up the conversation of, hey, maybe we get some things checked out.
Yeah, and after checking some of those things out, what are things you guys do or steps people can take to maybe help this?
So I always say the first thing with my patients is to see what we're working with. We got to figure out what we have as a foundation for our ears before we can make an appropriate recommendation of how to treat this and move forward. Because everybody's ears are different, just like everyone's healthcare is different. We should be taking this as a person-by-person approach and making those appropriate recommendations. So really talking with professionals and your other medical providers of what's going to be best for you, and really that first step is getting your ears checked and seeing what we're working with.
For sure. And what are some examples of different, treatments or things that you guys do there at Avera?
So here at Avera, we do a lot of different things. First is like screening for babies, and all the way up to geriatric ages and elderly populations, and treating with hearing aids, cochlear implants, bone conduction hearing aids, all sorts of stuff. We also work very closely with Avera ENT for any follow-ups with any surgical recommendations or procedures that they recommend for kids to geriatric populations.
Yeah, and how important is awareness for, maybe those experiencing this, or those that are around people that might be experiencing this as well?
Awareness is really key, because hearing loss untreated can look like a lot of different things. So not many people know this, but first step for a lot of things like cognitive decline or dementia, or even kids with autism, the first step is to kind of look at hearing loss and be like, well, is it hearing loss or is it these other things? So really that awareness, because it can look like so many different things.
For sure. Well, thank you so much for being here.
Thank you so much for having me, Bailey.
Stick around. We have more after the break.